This is the lecture on Chapter 15, Disorders and Conditions Resulting from Trauma. And I skipped many conditions. In fact, this slide shows the only diagnoses I am covering in this chapter. Now take note, this is very different. In all the other chapters I talked about those you wouldn't be tested on. Now here on this piece of paper, it's not a piece of paper, I know, it's a PowerPoint slide for you. I've listed the only diagnoses that I'm actually covering that you will be tested on for Chapter 15. So make a note, these are the ones we are covering, and we start with talking about the open trauma. Open trauma may involve only the skin surface, or it may extend to the soft tissue and structures far below the skin. And we're going to start with the very most superficial injuries like abrasions, and then talk about the more serious. Abrasion, just the outer layer of the skin has been scraped away. Very minor. Appears raw, reddened, and painful. As far as treatment, it's all about cleaning the abrasion and checking with the patient to see if they've had a tetanus shot. Tetanus toxoids are very important as far as receiving boosters if it's been a while since they've had a injection of the toxoid, and just keeping up to date with tetanus. Okay, avulsions, a tearing away forcibly of a part of the skin, tissue, or structure, resulting in severe pain and bleeding. And we show the avulsion of the tip of the finger there. It's hard for me to even look at. Avulsion. Portion of the skin and possibly underlying tissue is torn away. Can involve an entire limb or just the soft tissue in the area. Again, cleansing is so important. Closure of the open wound, covering, dressing, and checking on that tetanus toxoid when the person's had a vaccination of tetanus, for tetanus. Before you look at, well, actually, crushing injuries. We'll talk about crushing injuries first. Soft tissue is compressed, possibly involving bone, nerves, and vessels, causing pain with or without bleeding. Some part of the body is compressed between two surfaces with great pressure there. Usually involves a hand or a foot or a finger, and usually involves some heavy machinery that part of the body has gotten hung up in. Once you look at the word debrided there under treatment, treatment depends on severity and location of the injury. When an open wound is present, the area is cleansed, irrigated, and debrided if necessary. When they perform the debridement, they do a scrubbing of the area and possibly even a cutting away of the dirty material there. Be sure and look in the glossary for that term, debrided. Okay, puncture wound is the next condition described. Results when a pointed or sharp foreign object penetrates the soft tissue, like stepping on a nail, like a needle puncture. It causes pain but very little bleeding, and again, that you have to be sure that the person is up to date with their tetanus shot. Lacerations. The skin and possibly the underlying soft tissue are cut by a sharp object. Results in pain and bleeding. And as far as the treatment, again, the cleansing with soap and water, controlling the bleeding, and it may be enough just to use the Steri-Strip adhesive strips, or the person may actually have to have sutures to close the open wound from the laceration. And again, checking on that tetanus. Okay, and we'll skip over several conditions over to burns. and they're thermal insults. Burns can be caused truly by fire or by steam, hot liquid, chemicals, lightning, electricity, radiation. There's many different types of heat injuries. When a person has a burn, the physician should identify the degree of the burn. The degree of the burn is all about how many layers of the skin are involved. With a first degree burn, it's just the outer layer. There'll be redness, like a sunburn's a first degree burn. The second degree burn, there's redness and there's blister formation. The third degree, the epidermis and dermis are destroyed, and there'll be a just layer of charred white tissue left under the subcutaneous layer. The treatment of the burn depends on how severe the burn is and the area of body that is affected by the burn. Now over to cold injuries. Cold injuries include hypothermia and frostbite. So hypothermia is extreme cold, generalized cooling of the body in which the core temperature of the body drops below 95 degrees Fahrenheit. The person will shiver, feel extremely cold, numb. They'll start to lose their coordination, be very fatigued, and eventually the shivering stops and they become unable to even speak clearly. It's a major emergency. When the shivering stops, it's really clear that the person is literally freezing to death, the hypothermia. Look at the treatment. Any wet clothing must be removed. Gradual rewarming of the body by wrapping the person in warm blankets. Using hot packs. Using the warmth of another person's body just to keep them warm until they can get to the blankets and the other care. Okay, now frostbite. Freezing or the effect of freezing of a body part usually occurs with those areas that are exposed, like the fingers, the nose, the cheeks, the ears, the toes. Check out this picture where the person has frostbite of the ends of their fingers where the tissue is so damaged there. At first the area is cold, hard, and white. It has no feeling. Hopefully it will begin to warm and become kind of blotchy red and swollen. It will be painful. That's a later case that you're seeing in the picture there. There's also a really good picture in the book of frostbite of the toes. Look at treatment. Consists of removing the patient from the cold environment. Person should be warmed with an external source of even heat. The affected skin area should never be rubbed. Patients suffering from frostbite should be treated by a physician. The person should be kept warm, vital signs monitored, and alcohol should never be given. There are people that say, the alcohol's going to warm them from the inside. That's just not true. It's just not going to work. Okay, once you turn over several pages to carpal tunnel syndrome, it's really interesting information in this chapter, and I'm sure in your spare time you're going to want to go back and read over these. But as far as test material, I'm talking about the ones that you may be tested on. Look at the carpal tunnel syndrome, abbreviated CTS. It's compression of the median nerve as it passes between the ligaments, the bones, and the tendons in the wrist. The compression is by that wrist ligament, and the nerve is kind of caught between those other structures. The symptoms will be because of nerve damage, and the hand and finger will become very numb and even painful, especially at night. The person may have it in both hands, or it may just be in one hand, the hand that they use the most. It's also referred to as an overuse syndrome. The person is one that performs excessive and repetitive wrist movements. Now, one of the treatments listed is to stop the repetitive motions. Well, that may or may not be possible. Depends on what the person's job is. People who are especially prone to carpal tunnel syndrome are those that work at keyboards for long periods of time. Physical therapy may be effective in treatment of the carpal tunnel, anti-inflammatory drugs, the use of splints, and sometimes even surgery. And I've provided a picture there of the surgery being performed. Prevention is really important to help the person who does perform repetitive activities to know ways to stop and rest and exercise, and those working at keyboards to position their keyboards so that their wrist is not at a strained position, using the correct devices to avoid the carpal tunnel syndrome. Okay, tennis elbow, also called tennis elbow is also called lateral humeral epicondylitis. You can see why they would just call it tennis elbow. It's not a condition that only occurs in people who play tennis. It's all about the lateral epicondyle that you're seeing in the picture and the extensor muscles there. The extensor muscle that's attached to that lateral humeral condyle becomes inflamed because of some repetitive motion and stress on the joint. Treatment is resting that joint and trying to stop that repetitive motion. The use of braces, physical therapy, anti-inflammatory drugs. Non-steroid anti-inflammatory drugs are tried first. If the person doesn't respond, they may have to have steroid injections to relieve the pain of the tennis elbow. And then tendonitis, inflammation of a tendon. Maybe that the person has some repetitive motion, that they're not moving their arm correctly, so that they're developing this tendonitis. I said arm, it doesn't necessarily have to be an arm. It can be anywhere to develop tendonitis. Maybe an injury that results in the tendonitis. The treatment is all about reducing the pain, decreasing the inflammation, so anti-inflammatory drugs and the non-steroid and the steroids will be used, resting of the involved area, and then certainly physical therapy. The person may develop adhesions, scar-like tissue because of the tendonitis, and may have to have surgery to have that released, and then physical therapy again to regain their range of motion. This concludes Chapter 15's lecture.